Hello friends, this video is about COVID care. If you are a person who is suffering from COVID or if you have someone in your family or friend circle who is suffering from COVID, this video will be useful for you. But before starting this video, I have to tell you that I am not a professional doctor and whatever I am speaking is through my personal experience. So feel free to consult your doctor before having any medication and or diagnosis. How COVID affects us. See, COVID will affect different people in different way based on your innate immunity and based on the strain that you are getting. So you never know which side of the spectrum you are. That's why it becomes very important to take all the precautions. What are the precautions that you can take? First, avoid all the social gatherings, be it marriage, be it birthday party, be it any other functions. Avoid all the social gatherings. Avoid going outside unless and until it is very necessary. Wear your mask properly while you're going out. I have seen many people wearing their mask only to chin or to their mouth and taking out the mask while speaking to someone. This will not serve the purpose of wearing mask. Wearing mask fully covering your nose, mouth is very important when you go out. Have good ventilation in the room. If you are living more than one person in a room, please have good ventilation in the room. Open the door, open the window so that the air go out of the room and come in freely. If you close all the ventilation, if the air is not circulating, and there is a chances if one person get, other person can also catch the virus. Take extra care if you have any comorbidities. Comorbidity. Some of the major comorbidities are diabetes, obesity, blood pressure problem, heart problems. If you are having any of this comorbidity, please have all your health indicator in control. And I'm speaking about pre-COVID situation, that when you are all right, you have to have all your health indicator in control. That is, if you are having diabetes, you should have your sugar level in control. If you are obese, try reducing your weight at least to overweight, if not to the perfect BMI, and have your medication properly in the case of blood pressure or heart problem, and be as normal as possible. Symptoms. There are some common symptoms. Most common symptoms are fever, dry cough, and tiredness. Lesser common symptoms, you can have some of this, that is body ache, pain, sore throat, conjunctivitis, which means your eyes will be red, diarrhea, headache, loss of taste and smell, rashes on your skin, or discoloration of your fingers and toes. Discoloration of fingers and toes and rashes, conjunctivitis are becoming more and more common in the second wave. And there are serious symptoms that you should be very cautious about. Difficulty in breathing, shortness of breath, chest pain or pressure in chest, loss of speech or movement. About test, please I request you not to be scared of the test, because by early detection, COVID is no more than just a viral fever. So please don't neglect any common symptoms. Get the test done. Don't worry about what others think or what others say if you test positive. Leave their mind and leave their thought to themselves. Your health and your life is important for you and your family. So please go early for test if you have any symptoms. Whatever be the result, be it positive or negative. Positive, start medication, start consulting the doctor. But if it is negative, then also isolate yourself for some times, because there are many virus strain now in the second wave especially, which are jumping the test. So even if you test negative, if you are having a lot of symptoms, please take care of yourself. Ask your doctor whether you need to get a MRI scan or CT scan or any blood test or chest x-ray done. First step, if you test positive, is to isolate yourself and have your own vessels for having your food, and wear mask if you are going out of your room, and try not to touch any surface out of your room. This will keep your family members or your friends safe. Basic medications and care. All of this must be taken after consulting a doctor if you are having any common symptom, not serious symptom, and if you are got tested positive. You can have water vapor, you can have vitamin C and zinc chewable tablet, or if you don't get these tablets, nothing to worry. You search for food or fruits which are rich in vitamin C and zinc. Basically, citrus fruits will be rich in vitamin C, and many of the dry fruits will have zinc. You can take multivitamin tablets. You can have paracetamol if you are having fever, and please consult your doctor if the symptom persists, whether you have to take any antibiotic or not. Consult him and get whichever antibiotic he suggests you. See, all these treatments can be done in home isolation, so please don't block the bed in hospital if you are having common symptoms and if you are getting treated in these medications itself. And one of the important thing that you should know about is about pulse oximeter. So this is a medical device which will show you the oxygen saturation level in blood. You just have to clip it in one of your finger and press the button. That's it. It will show you the oxygen level. So if you are having any common symptoms, I suggest you buy it and keep track of your oxygen level. If you are feeling chest congestion or difficulty in breathing, you must have this device and constantly check your oxygen level. If your oxygen level is above 94 or 95, then continue consulting your doctor online. Please inform him about your oxygen level, and you can take medication in home isolation itself. There is no requirement of hospitalization at this stage. When we require hospitalization, then if your oxygen saturation level is constantly reducing and is going below 94 in the pulse oximeter, then you must reach a hospital. But before that, you have to inform your doctor if there is any case history, that is, if you had any major surgery pre or COVID time, then you have to inform that your doctor, because sometimes because of the surgery or because of any chronic diseases, your oxygen level will naturally be low. So the doctor will better decide if you are ill or if you are not. And nothing to worry if you get a bed at this condition, because if at this stage if you get proper medication in hospital, then you will recover in few days. So this is the golden line that you should not cross, that is, do not wait for the oxygen level to get lower than this. Prone position. If you are having chest congestion or if you are having difficulty in breathing, start sleeping in prone position as long as possible. This will increase oxygenation by giving your lungs more space to draw more oxygen. Basically, you have to sleep on your stomach like this. No need to stretch your hands like this. You can have it on your bed. If you are having any pillow, keep it under your stomach or your chest so that your lungs get the space to breathe. What to eat? You can have pulses, you can have dry fruit juice, or if you can have dry fruit directly, you can have it. ORS, oral rehydrating solution. Fruits, any fruits, but avoid fruits which can cause cold. Drink a lot of hot water. Do not add sugar for any of the food. Do not have glucose for energy, because during medication your sugar level will increase because of the medicines. So if you give extra sugar or food with higher glycemic index, then it will make things much difficult. While drinking or having food, adjust your bed. See, the COVID bed can be adjusted. Know that and use the bed properly. Or if you can sit upright, you please sit upright and have your food or drink anything. See, this may sound simple, but it becomes very important, because when you are on oxygen, it's all about your lungs and your windpipe. So you can't afford to get water or food inside your windpipe. Be confident, stay positive. The first half of your treatment and your cure will be taken care of by doctors and the medicines. But the next 50% will be cured by your confidence on yourself that you will get over it. And you can get over it, because millions have got over it and they are fine now. Remember all the good things that you have done in your life. Those good deeds will save you today. Do not watch news for obvious reasons. So keep a smile and face it with brave heart. If your loved one is in hospital, they may be your parents, your children, your friends. If they are normal, if they can walk around, if they can contact you through their mobile, then it's fine. Contact them once or twice a day to keep check on them. But if they are unable to walk, if they are bedridden, then if you think that you can take a risk, then it will be better if you go in to help them to have food and give physical and moral support only if the hospital permits. But you can try contacting them somehow, like giving a message to the security guard or giving the message to the doctor who is going inside. But the decision is up to you. If you go inside, then make sure that you wear a PPE kit and go inside the COVID care center. If you don't have PPE kit, make sure that you wear full arm shirt, full pant, shoes, gloves, face mask. I prefer you have N95 face mask and a face shield. Only with all these precautions enter the COVID care center. Things to know inside hospital. See, it's normal to have sugar spike because of the medications. So don't get tense by seeing your sugar level. It is because of the medication and it's temporary. After your medications are over, in most cases the sugar level will come down. That's why earlier in this video I have suggested diabetic patients to have their sugar in control, because while treatment the sugar will spike up. Do not put a lot of pressure when you are in bathroom if you are on oxygen support, because when you put a lot of pressure, your body and your mind will require more oxygen. When that is not there, you may faint. So take care. If you believe in God, you can chant, listen to slokas, or listen to any healing music. If you are someone who can walk around, you can listen to song and music with beats. But if you are a bedridden patient, I don't recommend you to listen to songs or music with beats. Songs, because it will have lyric, if it can trigger negative emotion sometimes. Music with beats, because it's a normal human tendency to get sync with the beat. That's why we tap our feet on the ground, tap our hand on our thighs. So when someone is bedridden, they can't do all these things. They try to match their breathing pattern with the beats, which may prove to be counterproductive. Check the water level in the oxygen kit. See, this is something called hydrator. Oxygen will come to this device, and from here the oxygen will be hydrated and then come to the mask. See, the basic reason is that the oxygen will be dry. To hydrate it, to add some moisture to it, normal drinking water will be put in this cabin. So when the water level drops down, just inform any hospital staff near you so that they refill it. But there is nothing to get panicked if it gets low, if it gets empty for certain time. Still you are getting oxygen, but the dry oxygen, nothing to worry. I don't think patient at this stage will be watching this video, but this is something that you should be knowing about if if you have someone inside the hospital at this stage. That is, if they are on high pressure oxygen supply, that is up to 60 to 80 liter per minute. At this stage, what happens is, though the oxygen will be hydrated, because of the pressure and because of the speed, it will be dry and it will come out with high pressure. No, so the patient's nose can bleed, and it's okay. Nothing to worry, it will heal afterwards. But when the patient start recovering, the doctor will start reducing the pressure. At this time, there is a risk that blood may come and clot in the nostrils and cause difficulty in breathing. So, if your patient is recovering and all of a sudden his oxygen saturation is getting low, this might be one of the many reasons. Ask your doctor, does the patient need to have saline nasal drops to reduce the block if it is there. I don't know much about ventilators. If there is someone who is watching who know about ventilators, please let us know about it in comment. Breathing exercises. There are certain simple breathing exercises that you can do while you are in general ward or when you are in your home. I have given the link in the description. All the video that I am suggesting now are done by professionals and you can count on it. I have tried all this, that's why I am giving it to you. It has worked for me for better recovery. Start the breathing exercises with minimum repetition, with less effort. As days goes by, increase the repetition and increase the repetition. You can have a lot of pranayama videos for good COVID recovery. You can watch it and learn which pranayamas are good for you at this stage. And this is something called spirometer. This will help you measure your lung capacity. You just have to suck air from this pipe. Based on number of the balls which goes up, your lung capacity can be measured. And it not just is a measuring device, it by itself is an exercise. So how to use the spirometer for betterment, how to use it to measure your lung capacity, I have given the video in the description. If you are having someone who is supporting you during the recovery stage, please show a video that I have given the link in the description about how these physiotherapies can be done. Show it to them. It is just a basic process of tapping the area near your lungs so that if there is any secretion stuck in your lower lungs, it can be mobilized. You should cough and spit the mucus out, don't drink it back. How you should cough and how you should spit is there in the video. Please watch the video. I have given the link in the description. Consult your doctor whether you need to take blood thinner for some days or not, because in most cases they will recommend blood thinners. If your doctor haven't suggested you, please ask them if you want to have blood thinners for sometimes. If you still have some problem breathing even after recovery, then you can consult a pulmonologist for advice. Not everyone will have the same kind of recovery. Some will have a easy one. Some will still be in oxygen support during the recovery phase even after their treatment. So there are some of the oxygen devices that we should know about. These are oxygen cylinders. They come in different sizes. Basically, the small sizes will be used for temporary movement or in ambulance or in stretchers. These big ones can be used in home. If you want to get oxygen in your home, take two of these big cylinders, one for constant supply, one for backup, and one gets empty. You can get it refilled and get it back to your home. This is a device called oxygen concentrator. This will convert the atmospheric air, extract the oxygen in it, concentrate the oxygen and get it to you through mask. So if your oxygen requirement is lesser than 8 liter per minute, then you can go for this. One thing that I want you to know is that the concentration of oxygen in oxygen concentrator will be lesser than what it will be in the cylinders, because in cylinders it is 100% oxygen. Here it will convert the atmospheric air, so the concentration will be less. The amount of oxygen that you will get in 8 liter per minute pressure will be equivalent to 10 liter per minute pressure in oxygen concentrator. And there is another thing called oxygen can. This can be used for temporary use if you are someone who don't need oxygen consistently, but you may need oxygen in some situations, like when you're bathing or when you go to toilet, you'll feel tired or you feel breathlessness. You can use it at that instant. You just have to take a puff, breathe in, breathe out, and then again take a puff, breathe in, breathe out. So like this, if you do 4 to 5 times, your oxygen level will get to normal. How can you avoid all these complications? Early detection, early treatment, and early recovery. If you get your test done early and start your treatment early, then you will recover within few days. So early detection is the key for avoiding all these complications. So please don't shy away to get your test done. Go get the test done and start your medication early if you test positive. Vaccination. Vaccination is the only solution that we have right now to break the chain. and many are talking about the efficacy of vaccines, but the experience say it is working, because if we see the data now in the second wave, most of the people who are getting hospitalized are below 45 years of age, which means above 45 who are got vaccinated, the rate of infection is very less, but it is not nil. You may still get infected by the virus even after vaccination, but it definitely reduces the risk of hospitalization as it increases the immunity. It not just make you immune for the current strain, it will also make you immune for the immediate mutant strains too. And coming to side effects, it's not actually side effects, they are effects of vaccine. See, for this we have to understand what is vaccine. Vaccine is nothing but same or similar virus in a attenuated form, that is in lesser powerful form. And the idea is that when same or similar virus get into you with lesser power, your immunity can overpower it. And when once your immunity overpowers, it remembers how to defend itself. And the common effects are you will get fever, headache, body ache for 2 to 3 days. And it's totally normal to get it. It means that your body is reacting, your body is getting immunized to it. So nothing to worry about the effects of the vaccine. But if that effect persists more than 3 to 4 days, you better get to a doctor, say that what is happening, and get treated. There is nothing complicated about it. And prepare yourself before getting the vaccine, which means if you are ill, if you are not at best of your health, then it is not a ideal time to get vaccine. So get a suggestion from your doctor whether you can get the vaccine at this time or not. I pray for all of you. Pray for yourself, for your loved one, and also pray for all the humanity. Let us all overcome this difficult time with lesser pain. And knowingly and unknowingly, we have learned a lot of lessons from this crisis. Write down what you have learned somewhere in your diary, or if you are open, you can comment below. I want to thank all the COVID warriors for their effort. Thank you for watching. Hope this video and the information in it will be useful for you. May the God bless all of us with good health. Thank you.